If you have been diagnosed with a vocal fold injury, these are the top questions that I would ask to make sure that you fully understand what is the nature of your diagnosis. Because while there are a standard set of names for vocal fold injuries, if you see one laryngologist versus the other, they might use slightly different words to describe what's going on. So it doesn't fully matter what the name of the diagnosis is, but these are the questions that you should ask to understand how the diagnosis might actually affect you. So first, we want to understand how the injury happened. Did it occur from a long time period of chronic vocal inefficiencies, or was the injury from a one-off thing, like you screamed at a sporting match and then suddenly you had a voice change? Are vocal irritants a part of the picture, or environment problems? I would also want to understand, do they see change in tissue on one side, on one vocal fold, or on both sides? And then I would ask about what are the risks of speaking and or singing while having this injury? For example, will you be able to sing around it without significant limitation? Sometimes a lump or bump is soft and pliable enough that you can actually sing with it without too much issue, but if that lesion is quite stiff or quite prominent in size, then that's going to be a lot harder to sing around. Then you'll want to ask your laryngologist if they think it's possible that the injury will resolve with voice therapy alone, or at least become manageable enough with voice therapy alone, or do they think that it's very likely that you'll need surgery? Sometimes there won't be a clear answer to that question at your initial visit, but over time, that's a question that we should keep asking. And then finally, how does treatment fit in with your vocal demands? So whether you're in voice therapy or you end up going a more medical surgical route, is there a period of voice rest that needs to be managed, or modified voice rest? So you may still be able to perform and use your voice, but there might